Welcome back to the NeuroHealth broadcast. This is your host, Dr. Joe, and we have another wonderful episode for you today. Today we are interviewing Dr. Mercedes Cook discussing Upper Cervical Chiropractic Care. Many of you may be unaware of some of the specialties that chiropractors can hold and why one might be beneficial for certain conditions. So Dr. Mercedes is going to do a great job of explaining upper cervical chiropractic care, why it's so important, the science behind why it's so important, who it helps the most with, and what you should expect at a visit. Dr. Cook is also the host of the Health Uncovered podcast, a really fantastic podcast doing similar styles of interviews. So after a quick word from our sponsor, our clinic, we will get right after it with Dr. Mercedes Cook and Upper Cervical Chiropractic Care. This podcast is brought to you by Delta NeuroHealth, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the NeuroHealth broadcast. I'm your host, Dr. Joe, and today we are joined by Dr. Mercedes Cook of the Health Uncovered podcast. Thank you for joining us today.
Thank you so much, Dr. Joe, for having me. I'm excited.
Of course. And you're not just from that podcast. You have a great practice, upper cervical practice in San Diego, California, which is going to be our main topic of today. Before we get into that too much, Dr. Cook, can you tell us a little bit about your health journey or your healthcare journey, I should say, and what got you into this field?
Yeah, for sure. So, growing up, I was a cheerleader and dancer my entire life. And I didn't really have any significant injuries per se. I mean, there are definitely some falls, but when you're younger, you're super resilient. So, you fall, you do things, and you feel fine. You don't have any symptoms. But when I got into my senior year of high school, I started to have really bad hip pain. It was affecting my cheerleading ability, my tumbling ability, all this stuff. And so that's when my parents were kind of looking into okay, what should we do about this? So of course we went to our primary doctor, told them I was having really bad hip pain. They sent me to PT. Unfortunately, I did PT for several months and it didn't help at all. And so we're just kind of looking for more answers, like what could be going on. We ended up getting imaging, MRIs. Still, they're like, well, nothing is wrong with your hip. And so we're just kind of looking for answers. And that's when I was introduced to chiropractic. And I had no idea about the various types of chiropractic. As your listeners probably know, there's traditional full spine, there's upper cervical practitioners, there's functional neurology practitioners, there's so many different types of techniques. And I just happened to go into an office near my hometown and it was upper cervical focused, which I had no idea what that meant at the time. But just in simple terms, it means that they specialize in analyzing and gently correcting the upper cervical spine or the upper part of your neck. And I was kind of confused when I went in because I was like, well, I have a hip problem. So I don't know how looking at my neck is going to affect this, but okay, great. We're just going to give this guy a shot. He had so many great reviews. Everybody in our town raved about this guy. So we went and he did this full assessment, looked at my posture, looked at range of motion, did some thermography scans, and basically told us that probably from dancing and cheerleading. I had misaligned the upper part of my spine, and that was kind of affecting my posture. And that could be why, doing all this treatment and PT for my hip wasn't really helping, because that's not where the root cause of the problem came. And I thought this guy was completely crazy, to be honest. But I didn't know what else to do. Like, we weren't getting help anywhere else. So I was like, great, just adjust my neck and let me see like what happens. And so I got adjusted, and at first I thought it was just like placebo effect, because I stood up and my hip felt better.
Mhm.
And I was like, okay, this I'm probably just in my head. I don't know. But I was going back for regular checkups. I started to hold my adjustments for long periods of time. And literally from that first adjustment, and then after I left, I didn't have hip pain again. So even though I was 18 at the time, it really sparked something in me like, okay, this guy he clearly knows something that I don't know, because he did this tiny little adjustment to my neck, and now my hip feels better. And not only that, I started to notice neurologically like a decrease in anxiety. I started to notice that my sleep was better. And so I was like, there's something going on with my brain, like my body.
Mhm.
I don't know, but I have to figure out what this is, because this is really cool. And so I asked to shadow him one day and just learn more about what he does. And I started seeing all of these people come in who had concussions, they had migraines, they had all these serious issues, and they were all getting better. And I thought that this was so wild, because I'd never seen anything like it. I
Mhm.
didn't know anything besides like just our normal, Western healthcare. And
Right.
so this kind of like opened a whole can of worms for me. And so ever since that experience when I was 18, I knew right away that that's like what I was supposed to do. I knew I wanted to be a doctor. I knew I wanted to help people. I just figured I would go to medical school, because I didn't know what other options were out there. But after having my own experience and then observing and seeing all these other people get better just through analyzing the spine, doing gentle adjustments, I thought that was amazing. I was like, wow, if I can help people not have to offer them pharmaceuticals or surgery, that would be incredible. And so that kind of got me on, or that is what got me on my own health journey. And I started to see a big change in myself. And so I wanted to start pursuing that so I could help other people do that as well. So,
That that's
yeah.
amazing. And I feel like the most passionate and dedicated practitioners are the ones that have seen it themselves and have benefited from it themselves. And you're definitely no exception there. And that's awesome that you've been able to, apply your journey and now help hundreds and thousands of people that come through your door. So
Yeah.
that's amazing.
It
Um,
is, like you said, it is really cool when I
mhm,
mean, there's tons of great doctors who haven't necessarily suffered from an injury or suffered from
yeah,
something that can still help you. But
mhm,
I will tell you, all the providers that I've worked with in my life, like you said, who have sort of been through it like you have, and they went on this journey, and that's like what got them to where they are. It is
mhm,
really special being able to work with them, because they really understand what you're going through, especially as you go through the process. Because, like anything, it doesn't matter if you're doing upper cervical, it doesn't matter if you're doing functional neurology, like it's not like you get one treatment and then everything is better, right? It is a journey. Like, your body takes time to heal no matter what you're doing. And so to be able to walk people through the process and encourage them and let them know that they're on the right track, and like giving them a timeline on what to expect, I think it really helps when you have had your own, personal experience with it. So,
yeah, exactly, exactly. And so thinking about upper cervical care, that obviously just changed your life for the better and so
yeah.
dramatically. It's just two bones, essentially, right? So these two bones totally changed the trajectory of your life and your career and your health and all your patients' life. When we think about that, like how do you explain why that's so powerful to your patients? Like, why was your hip so affected by the upper cervical spine?
Yeah. So when I have patients come in and they're first learning about upper cervical, and they kind of want to know, how can this help them? How does this relate to what they have going on? What I like to explain is upper cervical is going to do Well, it's going to do a lot of things from your body, but we're going to put it in like two categories. One is like the musculoskeletal postural side. So if you have a neck misalignment, it can cause everything basically from your head down to your feet will be affected. And so it's really cool to do a postural assessment of someone and show them how their head's tilted a little bit, their shoulders are tilted, how they have a short leg, and how after just getting, whether it's their atlas or their axis, whatever bone needs to be adjusted, getting that back into place, their posture evens out, their legs even out. And again, before getting into this care, I had no idea. But for me, I think now it's very clear why my hip was continually bothering me is because my neck misalignment was not being addressed. I had a left short leg, so left higher hip. And that was just a chronic thing that was happening. And I was putting more weight on my right side of my body versus my left. So these are always things that we look at in the assessment, because if you're looking to have better posture, carry even weight from left to right side, and whether you're having hip pain or shoulder pain or neck pain, like whatever it is, upper cervical potentially is one piece of the puzzle to that. So I explain, like, again, if you're having some sort of musculoskeletal pain or postural discrepancy, that is one thing that upper cervical can help with. And then, even though that was like the main thing that helped me, I would say the neurological side is more so my favorite thing to talk about.
Mhm.
And so, this is why, I mean, most people I think are drawn to chiropractic because they have neck pain, because they have back pain. And that's great. And that's fine because, of course, we can help them feel better with that. But the thing that I think every single person needs to know, and this is very similar to your work, is how your brain functions and how your nervous system works can be impacted from your neck. And so, especially your C1 and C2, because of how close the proximity is to the brainstem.
Mhm.
I think one thing that's very important in our field, sometimes people get this picture of like if you're misaligned, it's like pinching a nerve or it's like cutting off supply to your brainstem, and that's not true. Um, but what is happening is when your C1 or C2 are misaligned, and because of where it sits in the neck, it can create tension, it can restrict blood flow, it can restrict CSF flow. And so these structures not like having enough space in the spinal canal or being shifted one way versus the other, it changes our neurology and it changes how the nervous system works. So I think a lot of people relate to when we talk about like the fight or flight or the sympathetic nervous system.
Mhm.
When you have chronic misalignments, your body can get stuck in fight or flight or the parasympathetic. And so that's why I noticed a difference in so many of my patients who have chronic anxiety or have panic attacks, or they're like living in that fight or flight mode all the time. They don't sleep well, just by getting the upper cervical neck. Again, there are lots of factors as to why we feel the way we feel. But again, taking away the structural component of the upper cervical spine seems to help with so many of these things. And so when I'm explaining to patients like what can happen with your body and how what you're experiencing right now might relate to the upper cervical spine, I always like to go into detail about, again, the postural musculoskeletal side, but then also the neurological side,
Mhm.
because I think like they might not come in because of their digestion or because of their anxiety, but when they learn that this potentially could be a missing piece as to why they're always anxious, even though like everything's fine in their life or whatever it is,
Mhm.
it's really cool to bring, like, when you teach people how their body works and how they can kind of get to the root cause. It's really exciting because then they don't have to chase all of these things that are just kind of a band-aid or making them feel a little bit better, but not really getting to the root cause. Sorry, I don't know if I just got on a tangent there, but
No, that was great. That was great. I agree 100%. That was great.
yeah.
Um, and then I think also, there's just so many somatosensory receptors that are in the upper cervical spine, C1 and C2.
Yeah.
And, if it gets off for any reason, like you were saying, that can cause so many issues downstream and upstream from
Hmm.
there because the brain is constantly communicating with the body. And if there's a miscommunication somewhere, especially in one of the most important areas of the spine,
Yeah.
then everything's going to go haywire, right? Like you said,
Yeah.
you can have parasympathetic, sympathetic miscommunication, you can have musculoskeletal issues, you can have anxiety, difficulty with sleep, list goes on and on. So
Yeah.
not so simple of those two bones, right? Like it's
Right.
very, very important.
Yep.
Um, so how might somebody think to get their upper cervical neck addressed? Like
Yeah.
who might be a good candidate for that?
Yeah. I would say so there's really one overarching reason why your spine misaligns, and that's stress. And obviously, that is a very broad term, but to make it as simple as possible, I break it into two categories: physical stressors. So, if you are someone who, if you played sports when you were younger, if you are someone who has been rear-ended, you've ever had a whiplash injury, anything that would have affected your neck. And again, I always encourage people like, just remember when we're younger, we have injuries. Like I probably fell on my head, I don't know, countless times, like learning to do backflips and all the things, but I didn't think about it at the time at all because my neck didn't hurt. And so I always kind of encourage people to think back, like, what were you doing when you were younger? And now are you starting to get into your 30s and 40s and you have all these symptoms pop up? Because that's usually what happens. Like when you're younger, even sometimes in your 20s, you don't really have any symptoms. And then as you start to get older, your body starts to let you know, like, hey, something's not quite right. And it's usually something stemming from something that happened when we were younger.
Mhm.
So there's like the physical stressors. So if you've ever had any big physical stressors that, especially to your neck, so like any falls in San Diego, I see a lot of surfers and I see a lot of people who do jujitsu,
Mhm.
and which these people are crazy, like the neck holds that they do and all the things.
Mhm.
I really love their passion for jujitsu, and also they all should have an upper cervical chiropractor on
Mhm.
their team. So I encourage anyone who has, again, had any physical stressors, especially to the upper part of their spine, to have it looked at now. Even if you don't have symptoms per se, you can. I actually had someone come in my office yesterday she's 25. Her mom is a nurse and she somehow learned about upper cervical. And so she wanted her daughter just to come in to get her neck checked. And just if something was misaligned, just to put it back in. Like she has no symptoms at all.
Mhm.
And I thought that that was really cool. That's what I encourage everyone to do now. It's not really a standard in our healthcare right now to go, get your spine looked at and do anything preventative. But you
Mhm.
can certainly do that even if you don't have any symptoms, which I think is really cool. And I'm really glad she came in because we do something called a CBCT scan. So it's just a 3D scan of your neck, and her neck is completely straight. Her atlas like has no atlas plane line. It's completely flat. So she definitely will benefit greatly from getting her neck back in. Hopefully will help her get some curvature back. So posturally, she's in a better place. Again, she doesn't have any symptoms, which is great. So we're not working on eliminating any symptom. We're purely just working on keeping her spine in a good place so she maintains good posture. And then, of course, like a balanced nervous system. So that way, hopefully nothing comes up for her later down the road. So,
Right.
okay, back to the question. So we have our physical stressors and then we have our emotional stressors. So
Mhm.
some people come into my office and their neck is way out of whack. They have lots of misalignments, but they've never, well, I guess they tell me they've never had, any physical stressors as far as like they didn't play sports, they've never had a car accident, no falls, like nothing that they can think of physically. But what they have been through is a lot of childhood trauma, or they have lost their parents or lost people that they're really close to, or they went through a divorce, like things that are unexpected or cause a lot of emotional stress that can also certainly cause misalignment. So we can hold emotion and trauma and stress in our tissues in our body, and because of that, our muscles, our ligaments, where these things can be stored, of course, they attach to our spine. So can
Mhm.
misalignments happen because of that? Absolutely.
Yeah.
So those are the main things that I have people think about. Like if you have been through extreme emotional stress, or if you have had any big physical stressors, whether you have symptoms or not, I would recommend getting your upper cervical spine checked.
Mhm. And something that's been weighing on my mind and maybe yours is the trauma of birth, right? So. if I can say that.
Yeah. Yeah, of course.
Um, so we were all born at some point. So
Yep.
how how does that play into upper cervical
Yeah.
alignment and potential issues?
Well, interestingly, like because I do imaging on all of my patients, as long as they're over the age of 10, I have definitely noticed, especially in younger kids who their parents will bring them in and yeah, maybe they play sports, but they haven't had any like big injuries or falls or hits to the head. But what we're noticing as at such a young age, they've already completely lost their cervical curve in their neck. And so we have to wonder, well, how did that happen? Because developmentally, how things form in the neck and like when we learn neck control as a baby and we learn to like lift our head up as the first time and we develop that curve, everybody goes through and develops that process. So at some point something happens to us and we lose the curve. So I definitely have, it's definitely a hypothesis that, well, depending on what your birth process looks like, is it possible that maybe you were pulled out by your neck? Which is very likely. I see this happen all the time. Before going to chiropractic school, I used to shadow and I wanted to be OBGYN, or pediatrician. So I was like very interested in birth. And so I got to go to my local hospital and actually sit in and watch births. And what like watching doctors like pull their heads or their necks. I mean, I didn't know anything about the neck back then, but now I'm like, oh my gosh, that definitely could misalign or like start the body off in a place where it wasn't necessarily supposed to be just through the trauma and the stress of getting the baby out. So that's definitely possible. And
Mhm.
then now, especially depending on, if there were forceps used or they use vacuum sometimes to like suction the baby out. So what impact does that have on the spine? I mean, most kids that go, like, I've never had a kid come into my office who didn't need to be adjusted. So that definitely says something, right?
Mhm.
And I don't specialize in pediatrics. There's a lot of chiropractors that do specialize in pediatrics, which I think is amazing. But the really cool things that they see where, babies are colicky or they're constipated or having some of these neurological issues like speech delay, and then they're getting adjusted and these things are improving. It's really cool to see. So it makes you think, well, how did these kids get this misalignment? And so it is very likely, I think, that at birth it kind of started like just some minor shifts. And then as you learn to crawl and walk and fall, these kind of things can just like further progress. And I think that's why a lot of kids that I image now, even age like 10 to 15, they don't have any cervical curve. And so that's why I always encourage my parents who, because usually it's adults that are starting in my office and then they're like, "Oh, can I bring my kid in?" And I'm like, "Yeah,
Mhm.
absolutely. I recommend getting your child checked even if they don't have any symptoms now, just because if we can keep their curve, we can keep their posture, like hopefully we can avoid injury through sports. Hopefully we can have them have an adaptable nervous system so they have less issues as they get older. But it's such a great point. I mean, ideally,
Mhm.
if everyone could get checked after birth, I know once we have our baby, they will of course get checked
Mhm.
day one right
Yeah.
away. Um,
Will you
which
be
is
doing the honor?
I definitely think after I have the
Mhm.
baby, I definitely want to check, but I also have
Mhm.
some really great pediatric chiropractors in San Diego that I
Mhm.
love and know.
Yeah.
So I think as a parent, and I don't know if you experience this with like checking or seeing like your family. I think sometimes when you're seeing a family member, you can kind of
Yeah.
overthink it a little bit
Mhm.
or maybe even overlook things. So I will definitely bring our child to get checked by a pediatric chiropractor and someone who's really knowledgeable in like the cranial work, because
Mhm.
I'm not as knowledgeable. Like I know a basic assessment and looking at the atlas and things like that. So I'll definitely check them right away, but then hopefully get them into a pediatric chiropractor just to have like another set of eyes.
Right.
So
That's my
yeah,
plan too, because I think we have
I was gonna
our
ask.
specialties and we're good at
Yeah.
what we do, but that is something in and of itself that, needs very skilled hands, and which I'm sure you have. But for me, like, I don't work with a lot of little newborns, so
Yeah.
I think I'm going to defer to somebody who that's their specialty for sure.
No, well, I think that that's a great point. Like, it's really like your specialty is functional neurology, my specialty is
Hmm.
upper cervical. Like, we're both really good at what
Hmm.
we do. And when it comes to things that are outside of that, then always referring and having a good
Hmm.
referral for someone else who specializes, whether it's pediatrics or, like I
Hmm.
mentioned to you, I have my referrals for functional neurology that I love. So important to have very skilled practitioners because like we can't do it all. Like we'll
Right.
specialize in our thing and we'll be really good at our thing, and then we can let other people do their specialty, which is cool.
Right. And I think I don't think a lot of people realize that. I think when they think chiropractic, they have maybe one thing in mind,
Hmm.
but they don't realize that there are so many subspecialties and different things that you can really explore within this profession.
Yeah.
So, and I would say that we work with a lot of upper cervical docs. We work with a lot of pediatric docs, and so many times by the time they come to us, it's like nothing was helping until I went to see my upper cervical doc or my pediatric chiro, and then now my
Mhm.
kid is starting to behave more appropriately, or it helped reduce my dizziness or whatever it was. you know
Yeah.
a lot of time, I mean, if they make it to us, then, in that case, it still needed a little bit of extra work in some
Yep.
fashion. But
Yeah.
I mean, so many of those cases just don't end up making it to us because it's so effective. So
Yeah.
can you talk, I guess we were going to talk about how you interact with functional neurology and other things like that within your practice.
Yes, for sure. So within upper cervical, I think upper cervical providers and functional neurology providers, we definitely see very similar clientele, meaning anybody that has had a TBI or concussion, any sort of like head injury, even stroke related cases. Um, what else do we see? Especially like migraines,
Hmm.
anything like vestibular migraines, anything to do with the vestibular system. I think that this is just what I've seen in my years of practice so far. But there have been a handful of cases where they come in with any of those presentations, we'll say like a concussion or post-concussion related symptoms, and they get under upper cervical care, all their symptoms go away, they feel much better. And I'm like, okay, great. And normally I will give my patients like a six to 8 weeks to see how they respond. Are they holding really well? Are all of the symptoms pretty much subsiding at this point? And then my protocol is if not, when I do a re-exam, which is usually between 6 to 8 weeks, I will recommend like pairing with functional neurology, which happens with a lot of my concussion and traumatic brain injury cases. And so I'll let my patients know, hey, we've gotten 50% better, and that's amazing. I really think that you having a proper, like another cranial nerve assessment, looking deeper into the vestibular system, how your eyes are functioning. These are not tests and things that I do in my office, but I have a great clinic that I can refer you to who will do a very thorough assessment. And basically help us get you to back to 90 or 100% as good as we can get you. Like upper cervical is great, I need to be a part of your healthcare team, but adding on functional neurology is just going to help you heal faster and at a better rate. So that's usually how I approach it. And thankfully in San Diego, I have two amazing clinics that I can refer to, and my patients see great results. And usually with that combination of upper cervical and functional neurology, I have seen people recover from really, really bad concussions, who have, been struggling for years and years after that. And we've seen some really cool things. So I think pairing upper cervical and functional neurology is so, so powerful. And kind of like you mentioned, there actually are, I know like two, maybe three upper cervical docs who like they're deep into functional neurology and upper cervical, and more power to them because I think that combination is incredible.
Hmm.
I also personally, I just kind of went all in with upper cervical. Like I want to be the best at that. And thankfully, I have great people to refer to, so my patients can still have access to both. I just don't do both. And but I've seen people recover to a much like get closer to 100% than I think they would have whether they like just did functional neurology or they just did upper cervical. And it's gone both ways. Like some people have asked me, well, if I get a concussion, should I do functional neurology first and then come to upper cervical? Should I do the other way? I don't really think that there's necessarily a right
Mm-hmm.
or wrong answer.
Mm-hmm.
Like I've had my functional neurology practitioners, they've worked with people on their concussion protocols and then sent them over to me and vice versa. And it seems to work out really great. Or if you
Mm-hmm.
want to do both of them at the same time, also great. Depending on your nervous system, it might, like I've had patients where it's too much. I've had patients
Mm-hmm.
where it goes really well. So again, it just very, very patient dependent. But I always encourage whether it's either like a super complex case, meaning like your neurologist can't figure out what's wrong with you, you're having like, visual issues or complex migraines. And especially the concussion cases, I always encourage them to, like I said, if they start with upper cervical, I will sort of give them some space, give them some time and see how they improve for a couple weeks first, and then we'll
Mm-hmm.
add something on. I don't want to overload their nervous system per se in the beginning. So
Mm-hmm.
that's just how I do it. I'm sure there's lots of ways to do it, but that seems to work really well for my patients.
Yeah. And I think you nailed the head of the nail or whatever with the hammer. Uh, but yeah, you hit that right on the head with if the patients can handle it, I think I agree that doing both in tandem is great.
Yeah.
If they can handle it. Typically if patients are under that consistent care, I find that, I can kind of cross off part of my treatment plan that I need to worry about, right? Like I
Mhm.
am able to focus on some other things because I know that that area is being so well managed. And I
Yeah.
find that those patients do seem to get quicker improvements too. So
Mhm.
um, I love the combination.
Me
And
too.
in functional neurology, we work a lot with stabilizing eye movements, right?
Yeah.
Typically, this is something that is compromised after cervical or concussion injuries. And there's a very intimate connection between the upper cervical spine and eyes. And one of my favorite things to do with patients is to say, okay, so go touch your upper cervical spine right below the base of your skull, and then move your eyes left and right, and you can actually feel those muscles moving underneath your fingertips. It's like that's how intimate that connection is between the upper cervical spine and the eyes. And
Yeah.
you can't see it as much, but the vestibular system is also tied in with that and the integration between the three. So making sure all three of these systems are communicating appropriately is so important, especially for
Yeah.
dizziness, balance, concussion rehab. It's yeah.
Yeah. I love that.
So one of my favorite questions to ask providers is, what are some of your favorite cases in practice?
Yeah. So I will tell you, I have a very specific profile, I feel like that always shows up in my office. And so I just want to paint you guys a picture because I hope anybody listening, if they kind of fit into this box, it will help spark some interest if maybe upper cervical is something that they've never tried. And that is typically females between the ages of 25 and 45. They will come in and they will experience anxiety. Sometimes it's just generalized anxiety. Sometimes it's heightened to the level of panic attacks, but they're also experiencing either headaches or migraines, sometimes both. And usually it is a profile of like they just kind of have a low grade, constant headache all the time. Sometimes it will progress into a migraine. And then the other one is a lot of times they'll also experience brain fog. So, if you don't know what brain fog is, it's usually just like your thoughts or your ability to, like, you either lose focus or concentration really easily, or you keep like forgetting things or recalling what you're trying to think of. So, it's just kind of cloudy up there. That's why we call it brain fog. But I would say those three symptoms are extremely extremely common, especially with women. I do have some men that struggle or go through that as well, but for some reason it seems like most women between 25 and 45. And what we found through the upper cervical work is, again, their body is stuck in sympathetic from having a chronic neck misalignment. And so that's where I feel like the nervous system and doing like little hacks to like get you into parasympathetic is super popular now. And I'm sure you're very well versed in this, right? Like people are like, I meditate, I do yoga, I sing, I do all these things for my vagus nerve, right? But none of it is helping or is like a very long lasting thing. And so that is a sign that, okay, you can do all the meditation you want, you can do all of like the nervous system balancing protocols and deep breathing that people instruct you to do, and if it's not helping, especially long term, then that is how you know there is likely a structural misalignment that has been there for a while, and it's not going to fix it itself. Like you can't deep breathe your way out of that, unfortunately. And so what we found is when we start like this certain type of profile of women, when we start adjusting them, one, it does bring their nervous system back into a more balanced state. So they will be able to, like, it's not that we should never go into sympathetics, right? There are certainly times throughout our day where our body should be in sympathetic, and that's fine. But as soon as we come, like, we should be able to switch back and forth pretty frequently throughout our day. And so we're just able to make their nervous system a little bit more adaptable. So after a couple of weeks, they notice, like, wow, I was having panic attacks, every other day or every week, and now I'm not having any, which is amazing.
Mhm.
And then the other cool thing that I love to mention is the whole brain fog thing, because having brain fog, again, there can be certain factors to this. It can be something you're eating, it can be environmental toxic exposure. But one thing that I think a lot of people don't really talk about is the what happens when you have a chronic upper cervical neck misalignment is you have something called CSF, cerebral spinal fluid. It's the clear fluid that bathes the brain, it bathes the spinal cord. It helps clear out heavy metals and toxins. And so when you have an upper cervical misalignment, it's not that the CSF just stops flowing altogether. Of course, it doesn't. But it can start pooling, it can be more sluggish. And so the rate at which your body can detox or eliminate heavy metals can be decreased. And so that is why we see when, okay, now we get the neck back in, we get patients holding for several weeks, several months, and they're like, wow, like it seems like my thinking is much clearer, my brain fog's going down. And again, it's not because upper cervical is a fix for that. All I'm doing is just restoring your body and your upper cervical spine back to where it should be. So the CSF is circulating and flowing properly. And then that is why we see things like the brain fog, the panic attacks, anxiety. That's why we see those things get better, which I think is so cool. And kind of like we were talking about before, it's amazing when people are like, most of these people coming in, of course, they have some kind of pain, they'll have neck pain and things like that. But when you can help someone get rid of their brain fog or not have panic attacks every day, like that's huge. That changes their whole life. And so it's really cool to be able to offer them something again that is gentle, painless. They don't have to take drugs every day for, anxiety. It just, hey, let's just get your neck back in so your body can function like it's supposed to. And now things are greatly improved.
Yeah.
So that was a very long answer, but
Oh,
that
yeah.
is absolutely my favorite type of patient to work with.
hmm And I think, you listed off, XYZ symptom that people commonly benefit from with upper cervical care. And, it's kind of nonchalant, like, yeah, we help with brain fog and, anxiety and sleep and panic attacks. And take a step back, it's like to be able to do that without medication and by restoring the body to, proper function, that's pretty amazing, right? Like, I
Yeah.
feel like our society always goes towards, okay, well, I have brain fog, what should I take? So the
Yep.
fact that I just want to take a moment and step back and just appreciate that for what it is, right? Like that's incredible.
Yeah.
So,
No, I completely agree. Like every day, there's not a day that I don't go into my office or something happens and I'm just like, I think because of the nature of our work, we do see amazing things in our practices all the time. So sometimes it's easy to forget, like, whoa, this is really cool and really powerful, but we're just used to seeing it all the time. So we kind
Hmm.
of get used to it.
Hmm.
But I'm really glad that you said that because it is true. Like every day I want to stop and like think about this more. Like this is a game changer, right?
Hmm.
And I recently did an episode on my podcast where I was kind of talking about anxiety, like mental health stuff, anxiety, depression, and just some tips and things that you can do for it because I really hate that it's not that I don't like Western medicine or that I'm not appreciative of some of the pharmaceutical advances that we have, because sometimes there are life-threatening things that it's amazing that we have the things that we have. But when it comes to some things, especially like mental health, I think we completely miss the boat on helping people get their body back to a better place. Like there's so many things that can be done before even considering pharmaceuticals. But unfortunately, that's kind of like the number one thing that we
Hmm.
do, right?
Yeah.
And so that's why I hope to inspire people. Like if you are struggling with these things, and even if you're on medication now, like if if your goal or you want to get off of it or you want to find other things that you can do for yourself, like it is possible. It takes
Hmm.
work, but it's possible. So,
Yeah. And I think that's a good segue into what you're doing now, your new podcast, fantastic new podcast, and bringing together like-minded practitioners to help people kind of achieve those goals, right?
yeah. So right now, or back in December, I started Health Uncovered with Mercedes Cook. And what I'm doing is I am every month. So there's an episode that comes out every Thursday. And so three of them will be guest episodes. So I don't know if you saw, but I interviewed Dr. Cameron, a
Hmm.
functional neurologist in San Diego. So we talked about concussion, but I'm interviewing other providers, specifically ones that I refer to right now in San Diego that I have personally had experience with, and then I'm going to kind of branch out from there. But I'm interviewing other providers with kind of unique specialties that maybe you wouldn't have heard about before, or even I think sometimes even bringing up like a physical therapist. Like everybody has in their head what they are, but just like chiropractors, they have so many specialties. They
Hmm.
have, different like different skill sets. And so my goal is to interview as many providers with as many specialties as possible. So if you're struggling with something, you can find the right provider to work with. Because I think sometimes people start to lose hope after they've been to like doctor after doctor, or they've already seen three chiropractors and it's not helping. Um, Sometimes I think if we just have more information about what specialties are out there and what can be done, then hopefully this will at least help people just kind of get connected with the right providers. And then on top of that, I'm sure you see this quite a bit. I'm really passionate about one, learning about what other providers do, because again, I have my specialty, I do what I do, but there's a lot of instances where I need to refer them for something else. And so I want to make sure that I refer them to the right person. I want to make sure they're going to get good results. And so that's why I take a lot of time to learn about the different options that are out there. So not only does it help me personally in my own health journey, but it also helps a lot of my patients. And so my hope is that other healthcare providers will also listen to this podcast so that way they can start to educate themselves more, because nothing frustrates me when people go to their primary or they go to a PT and they don't get any answers, they don't get any help, and then they're just like, well, not really sure what you should do. And so I think a sign of a good provider is if you can't help someone or you're not helping someone, then you do your due diligence to at least steer them in a different direction. Don't leave
Hmm.
them thinking like, wow, there's nothing that can be done. And so, and like if the podcast does anything, I just hope that it helps other providers learn what's out there. And then also from a patient perspective, anybody can listen to it and learn and kind of seek out what else is out there and what could help them, because I think so many people are struggling right now with things that they shouldn't have to struggle with. And so that's what I hope that we can use this. And you're doing this with your podcast too. But if people listen and they're going through something similar, we can at least steer them hopefully in the right direction so they can find the help that they need.
Right. I think that was a huge goal of mine with starting this podcast initially is there's so many interesting practitioners out there. And if you are not in it, you may not get it, right? Like you may
Right.
not get the nuances, you may not get, how this person is different than this person and why this might be really good for this, so on and so forth. And even within like upper cervical, even within functional neurology, there's so many people who specialize in one thing or another and are doing so many cool things for patients. And it's like, this is just a good place to accumulate that information and share that knowledge with people so that they don't have to wade through going to different practitioners. It's like, okay, that sounds like somebody that can help me.
Yeah.
So I'm going to reach out to them or someone like them. So I
Yeah.
think what you're doing is fantastic and uh, that's great. So
Yeah. Thank you. Well, hopefully, between the both of us, Dr. Joe, we will get people to the right providers and where they need to go, and the world will be a better place. That'll be great.
yes, one podcast at a time.
Yeah, that's right.
So, before we conclude, can you just
Yeah.
remind our listeners how they can find out more about you and your practice, as well as you and your podcast?
Yeah, for sure. So my practice name is Upper Cervical Chiropractic San Diego, if you want to look us up on Google. But I also have a podcast if you want to follow Dr. Mercedes Cook on Instagram. That is where I mostly post about podcasts and different providers. And then I also have an office podcast, which is Upper Cervical San Diego. So we have two Instagrams. I would say those are the best places to follow us. And so that way you can learn more either about upper cervical or the office, or if you're more interested in the podcast and learning about other providers, then you can follow along there.
Awesome. Awesome. Well, this has been fantastic. I've really enjoyed getting to speak with you and learning more about upper cervical care, and I know our listeners are going to as well. So, thank you again.
Yeah, thank you so much for having me.
Of course. Well, until next time, everyone else, take care.